Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we did poll you guys and got a bunch of questions, and I'm just going to answer some of the ones that I feel like don't need a whole video devoted to them, so we can just, say we've talked about them. If you want further clarification about any of the things, feel free to leave comments, but otherwise, let it all be known that we got your questions and here are the responses. So, question number one was, what are the latest trends in facial plastic surgery? I think that goes with another question, which was, what are the most popular facial plastic surgery trends you're seeing in 2024? According to what I have seen, and that's in social media and news and the patients that I've gotten, it seems like the most popular thing right now is that people are starting to realize maybe the downsides of getting too much filler. And so people are starting to ditch some of the non-surgical treatments such as filler and are starting to become more interested in possibly doing surgical treatments even earlier than they might have been. So I've definitely gotten a fair handful of patients now who come to me because they are ready to do a facelift at age 40 or 50, and they're like, I just don't even want to waste my time on filler because of XYZ. So I think that's a common one. Next is, why does everyone on TV look like they've had so much work done, but they are all in their early 20s, such as Love Island and all these other things? So I also saw that casting of all the people, I think in somewhere where everyone looked older and they've just all had a bunch of filler. Why? I mean, it's because they've had a lot of work done. And I think the hardest thing is that, one, patients don't know when to stop, and two, there are people out there who don't know when to say no. So patients will always be able to go shop around and find some injector who's willing to put something in their face if they pay enough money. I personally don't think that's very ethical, but unfortunately it does exist out there. And so that's how you get these people with these very overdone looks, and then they try to keep up with the Kardashians, so they see all their friends look this way, so they also want to look that way too, not realizing how far they've actually come from their natural face and how perhaps a little bit distorted things have become. This is why we take so many photos every time you come into the office, because we want to be able to track your progress and we can show you how far you've come, so that way you don't go a little bit overboard. What are my thoughts about celebrities lying about having had work done, such as the Kardashians and J.Lo? I personally don't have any cares on this. As someone who was in LA, I have had my fair share of celebrity patients, and I personally think, they can share whatever they want. They already share so much of their lives with the rest of us. If they want to cover up what they've had done, then power to them. I don't, however, I will say, love the fact that there are a lot of people who are trying to sell lifestyle as the reason why they look so good, because I think that does give false promises, but we'll leave that as that. How is social media influencing trends and patient expectations in facial plastic surgery? I think it's been a double-edged sword. On the one hand, because you have so much more access to information from a variety of people in the world, patients are coming in a lot more educated in general about procedures, what to expect, the recovery, everything, downsides, complications, and that's great because it saves me a lot of the education time. But conversely, you also get a lot of patients who think that everything that they see online is real. And so then we have to spend a lot more time talking about, well, why did that specific thing happen to that person? And why might it not happen to you? So it's just sort of changed the nature of how consults go. I personally think it's probably been a good tool, because I always think in general, just having access to more information is better. And at the end of the day, Face the Facts here, we are doing this, is a social media delivery education device. So, who's to hate on that? I can't hate on that, certainly. But I do think it's important to think about where you're getting the information from and how common it is actually, and then talk to people that you trust, doctors, injectors, etc., and see what they think about all of those things. So that's a whole bunch of questions that we just went over. Those are just all my personal opinions. They do not reflect West End's or any other providers. Okay, these are just mine, as in Dr. Wang's opinions. And that's what I have to say about all those topics. We look forward to seeing you guys next time on Face the Facts. If you have any other additional questions you want me to talk about, controversial or not, please feel free to leave them in the comments.